Hello friends, this is Dr. B Kushwaha, Associate Professor in the Division of Veterinary Complex at FBSc and here Scotch. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and bell icon for the further notification. So in this video I am going to demonstrate you how to develop radiograph by CR system. So for the exposure of the femur bone, and this is the mediolateral view. This is the medial part of the thigh and this is the lateral part of the thigh. So mediolateral view means the medial part should faces the X-ray view, whereas the lateral part is towards the cassette. Or in other words, you can say the entry of the X-ray beam should be from the medial side and it should exit from the lateral side. So I have sedated deliberately this animal because there is a pain, so just to reduce the pain and also make the exposure very easy. So kindly hold like this, okay. So we try to update this contralateral limb as far as possible. So now the center of the beam should be here. We also have this bucky portal, but the thickness of this thigh area it is less than 10 centimeters, so that's why I am not using the grate. Otherwise, if it is definitely if more than 10 centimeters, so definitely this cassette is normally put here in the bucky. So this is the 600 mA X-ray machine. So we have already set the different exposure factors. So you could see here, this is the MAS, this is the MA milliampere, and this is the kilovoltage peak. So we have kept this MAS 8, kilovoltage peak 50, and this milliampere 160. So the moment I expose, so definitely there will be deflection of the needle, and there is this glow of this green light. It will be done. So now X-ray exposure has been done. We have just taken the mediolateral view. Now we are going to take the AP view. So AP view for the femur, AP view normally we position in a ventrodorsal. So although the animal is the ventrodorsal, but the exposure of the, as far as the femur bone is concerned, so for femur it is basically the AP view, because this is the anterior, this is the posterior part. So now the thickness has changed. So in this particular case, you could see here. Now simply I insert this here. Now this is the area for. We position the animal like this. So now there should be basically a dim light, subdued light, but here since the light is removed, so that is why it is difficult to align the center prime and center ring. Okay, now this is okay. So this is basically, although the animal in the ventrodorsal is commencing, but for the femur bone it is actually the AP view. So since the width now increases, so we have to increase the proportionate, so we have to increase the exposure factor as well. So now I have increased the exposure factor from 8 to 9.6, and this kilovoltage up to 57 or 50, even 60 is okay. So now we have exposed the femur in both mediolateral and anterior posterior view. So now we we are going to process the exposed cassette. So this cassette basically is the CR cassette. So to start this system, so we should on this machine. So this one is the reader. So basically read this imaging plate, and this is the monitor. So this is for entry. So for entry, so when you open this CR software, so basically you will find the this interface. So this is the for new patient. You click on the new patient. Then this is the date of the study. Then the study time. This is the client ID. So here we fill the client ID. 2170. Then client name. So name is Vikash. So we simply type here Vikash. And then the animal name. So animal name is Kalu. So we type the here Kalu. Then the breed is basically the non-descript breed. So you can also find in the drop box. Then date of birth. Age of the dog is 1 year 1 month. So we should here. This is 31st age. So we first this is the July, and then we then we click here the 31st July 2021. So now you could see here this is the 1 year and 1 month. This is the male. So we just select the male. So there is no tattoo chips, so we leave as such. Now then we select the part which has been exposed. So this is the limb, this is the hind leg. So in hind leg, this is the lateral large. Then we select this one, and then finally we start. So you can insert it. Then this one you have to insert like this one. So this sound you put here, and now you could see here. So now it is scanning. You could see here. And at the same time, you could also see the how much has been scanned. Almost it is 40% around. So usually take 1 minute. Now it is 50%, 55%. So still scanning is going on. Yeah, now it has been scanned. So you could see here the image. Now this is the image. So we have to rotate. So here you could see the different panel for the manipulation of the image. So you can rotate here. So this is not ideal. So then we flip horizontally. Now this one. So even you could see there is a little bit overlapping of this proximal extremity of the femur with the contralateral limb. So that is why this is looking very radio opaque. So since there was infection at the site of this fracture, so as per the radiograph, the fracture still is to be healed, or you could say the fracture has not been healed properly. So now this ready means now you could remove this cassette and like this, and then the second one, this one we insert. So for insertion, if you see the front of this CR cassette, so you will find the arrow. This is orange arrow. So this arrow, head of the arrow should be on side. So while inserting, you should take care of this one. So you just insert like this, and then simply put one hand for the support. So for the second for the subsequent radiograph, there is no need to select. Then once the scan completed, then you can change the view. So you could see now the second imaging plate is being scanning now. So now you could see the second imaging plate or CR system we have also scanned. So since we have not select the different this view, so here you just change the view, then you select this one hind leg, and this is the craniocaudal. So craniocaudal large, this one. So now you could see the change in the contrast. So the orientation of this radiograph is not okay. So from this software units or different setting, we change this one. This is the anterior posterior view of the femur bone, or if you say in terms of the hip joint, so definitely it would be a ventrodorsal view of the hip joint. So since we have not put any marker at the time of exposure, so the same you could do by here the different things, like here is the left, this is left side, and similarly here so you select the left and put here left side. And even if you feel that the exposure has been not made perfectly, so by selecting here, so you select this imaging processing slide, so you select the brightness from here. So before doing that, so you could select, you could decrease the brightness or increase the brightness as per the requirement, then latitude accordingly. Then contrast and sharpness, normally we keep 50%, and then the noise is 0. So now it looks comfortably better. So from this mediolateral view, it seems that the still bone has not healed properly, because here the radiolucent line is seen. You could see here, here and here. But on the anterior posterior view, because of the overlapping, it's appeared that the bone has healed. So since the only 40 days has been passed after the surgery, so now we will advise the owner to keep for a couple of weeks, and then we take another radiograph before removing the pin. So on day of presentation, there was a fracture of this acetabulum also. So but now, right now, it's looks that it has got healed. So overall, nice animal is able to stand and even able to walk. So this is how you can process the imaging plate on CR system. So thank you very much for watching this video, and if you are new to the channel, so kindly subscribe the channel, and if you like the video, so kindly share with your friends. Thank you very much.